Hello, my name's Ian Goulding. I'm an international expert in food safety working for the United Nations Industrial Development Organization, and I've been working on the EU Sri Lanka Trade-Related Assistance Project, which is funded by the European Union. This is a presentation about the proposals which we have developed in our project for reform of the food safety system in Sri Lanka. This is the fourth of four presentations addressing different aspects of food safety as a result of the work we've been doing recently in the project. First of all, of course, why do we need to improve the food safety situation in Sri Lanka? Well, we have here on this slide a comparison of the food safety conditions in terms of the number of illnesses and the impacts which it has on society. Based on WHO data, we've been able to estimate that in Sri Lanka there are 4.7 million cases of foodborne illnesses every year, something like 565 deaths, and in a population of 21.4 million, these are quite significant. The death adjusted lost years in terms of the amount of lost productive input as a result of these illnesses is estimated to be something like 133,000 years annually of productive labour are lost due to these foodborne and food-related illnesses. So it's a significant impediment which holds back national development. The system was reviewed in some detail by the FAO in 2016. It identified a number of important features which undermined the effectiveness and efficiency of the system. It identified that there were multiple overlapping and uncoordinated mandates for food safety risk management, that modern control concepts such as risk-based inspections and hazard analysis approach were not widely applied. There were some important functions not addressed, with gaps in the control system, especially from the point of view of how scientific advice, modern advice and understanding about food safety hazards was effectively integrated in the decisions made by government when they were regulating aspects of food. A lack of transparency and weak accountability, very difficult to understand sometimes the reasons for various decisions made by regulators when designing or applying food safety measures. An extensive reliance on end product testing, which, as we've seen in previous presentations, is not a very effective way of ensuring food is safe. The knowledgeability of the inspectors, the capacity of inspectors was rather limited in terms of their professional qualifications, and a lot of measures were mixed between sanitary and phytosanitary measures and technical measures applying to things like food quality. So mixing quality and safety in the same measure gives a lack of clarity in terms of what are the priorities of the regulatory system. The legal framework was identified as being rather outdated. In some cases, measures going back to colonial era, so very much relying on legacy systems. Border controls were not effectively integrated with domestic controls, and a lot of controls were focused on the end product rather than looking at the whole of the supply chain. Traceability and recall as a tool was not effectively applied, and the links to plant and animal health were not well managed. So these are identified problems which have been discussed at great length, and this was really the starting point for a food safety policy reform process, with a view to looking to the future and asking the question, well, how can we fix some or all of these problems through reforming the way in which government approaches the regulation of food safety. So the government has launched a food safety policy reform led by the Ministry of Health, with the participation of all of the existing regulatory bodies and stakeholders, and creating a working group. Consultants have been engaged, financed by the WHO, and support has also been provided by FAO and UN. So 3 UN organizations contributing towards the reform process, and a policy review and policy document has been drafted, and stakeholder workshops are underway. And UNIDO has been involved in supporting this process. I think it's important to revisit this slide, which I showed in an earlier presentation, where it shows that it's useful to think of food safety reform at different levels, and that all levels are going to need reform, but they're not all addressed necessarily in the same way, or within the same instruments or within the same institutions. So we have the different levels, top level formulation of policy, risk management, decisions about regulations, so regulatory decisions. Secondly, we have a coordination role where we need to coordinate all of the system, different inspection bodies, laboratories, making sure that everyone is pulling together in the same direction, responding to individual hazards or threats as they arise. Then you have level 3, inspection and enforcement. These are your inspection bodies, people who are going out doing the frontline inspections. They can be local authorities, they can be other institutions. And level 4, education and training, both at the level of professional food safety analysts, if you like, the people who actually go out and either test food or decide what is safe, what is not safe. So very high level specialist knowledge required. Or at the same time, anyone who works in a food business, who puts their hand in food, has to be trained to know what the rules are in terms of how to behave to make sure food is safe. And of course the system also has to have links to animal health, plant health, and if required, food quality measures. And then we have laboratory testing services. So all of these elements need to be present and reflected in a food safety system, and policy should have something to say about all of them, about how they're going to be organized, how they're going to be set up legally, institutionally, and how they're all going to work together. And that is the aim of a food safety policy, and the reform process in Sri Lanka should reflect this paradigm. So in terms of the current system, the current approach is divided really between several bodies with risk management functions. These are bodies which have some powers in law to pass regulations about food safety. So we have the Ministry of Health, we have the Sri Lankan Standards Institute, we have the Consumer Affairs Authority, we have the Ministry of Local Government with some regulations historically concerning meat. We have the Department of Fisheries, which is regulating on fish export safety, and of course provincial councils under the Constitution have some regulatory powers. So there's a mix of bodies here which have some capacity in law to pass regulations. And of course they've all been doing so, but not necessarily in a coordinated manner. So one of the reform proposals which we are recommending is to reform these mandates to create a single risk management body. This would be a food safety authority with exclusive powers to pass regulations on food safety. It makes no sense whatsoever to have several bodies independently empowered to pass regulations on the same function, on the same area of government business. You don't do it in any other area of governance. You know, education passes regulations on it, on education. Transport passes regulations on transport, and so on. It doesn't make sense to have more than one institution, more than one ministry with powers to pass regulations on the same subject. Even when it comes down to SPS issues, 3 issues addressed in the sanitary and phytosanitary agreement: food safety, animal health and plant health. Plant health is a unitary competent authority under the Ministry of Agriculture. Animal health as a unitary competent authority should be the same for food safety. So this is the key aspect of reform. We're not saying inspection. Of course, you can have many different inspection bodies, local government, national government, different ministries. That's not a problem. The problem is, the core problem faced by the country presently is this overlapping regulatory powers. So one way of solving this is to come up with a single risk management body, and that should be a food safety authority. Now, where that is located is very much a policy decision. It could be under one of the currently mandated ministries, such as the Ministry of Health, or it could be independent within the government reporting to a non-line ministry, such as a presidency or a prime minister or a parliament, and so on. But one of the things that does need to be considered is whether these regulatory functions of animal health and food safety should be combined. A lot of food safety issues are linked to products of animal origin. That is undeniable, and therefore the concertination of food safety and animal health controls has in many countries been found to be a beneficial step which brings improved coordination along the supply chain for products of animal origin. Another policy issue to consider is how to address TBT regulations. In other words, those regulations concerned with food grading, compositional standards, labeling, fraudulent practices in relation to food. Do you want to put those in with your food safety control bodies and institutions, or do you treat them separately? Again, there are no right answers here. Different countries come to different solutions, and this is very much a sovereign decision of any country creating a food safety system. And similarly, there is a need to try and integrate the national SPS controls on the borders with the controls implemented by the customs authorities, and to put them into the computer system so that the national regulations are also applied effectively at the borders. Another element of reform is to come up with new legislation, particularly in the form of a new Food Safety Act, and that would seek to establish the principles of control, define the control tools. It's not just a question of prosecuting offenders. You have to give regulators tools with which they can actually require food business operators to introduce improved food safety. It's not a question of punishment. Punitive aspects, punitive regulations are not very effective. You need ways to coerce and push operators to improve their food safety, or you remove them from the supply chain. And that way you actually get improvements in, in food safety. So the regulatory powers should be unified under the Food Safety Authority so that all food regulations are made within a single framework. And of course, different inspection bodies can be retained, but they have mandates to implement a common set of regulatory requirements within the scope of their mandate, however that is defined spatially or in terms of sectors or distribution levels or whatever. And particularly in Sri Lanka, there is a difficulty which has arisen because of a number of standards adopted by the Sri Lankan Standards Institute have been enforced or encodified into law. And these rather complicate the approach to legislation because of the extensive use of sampling and testing as the control model, which, as we've heard in previous presentations, is not an effective approach. So then, of course, under the new Food Safety Act, there would be a completely new set of technical regulations, essentially, applicable to food business operators, focusing only on food safety, and as far as possible, horizontal measures applicable across all sectors. And then also there should be regulations which define the control system. So setting the rules for inspection and control and how the system functions, particularly in relation to central and provincial governments, where that relationship between those levels of government is very important to ensure that it is managed effectively in the context of food safety. And then the food safety bodies need to be defined, but these would include the Food Safety Authority, provincial governments, municipalities, other mandated central government bodies, taking into account, of course, the constitutional position, the technical capacities, but always any body which is undertaking an inspection and enforcement role should be subject to annual plans and annual reporting requirements, but also they should be audited to ensure that they are performing according to the mandate and are effectively applying and enforcing the regulations which are in force. Then, of course, there is a big challenge of building technical capacities. Food inspectors need to be dedicated professionals, not multitasking officers. I trained as a public health inspector in the UK, and I was dealing with housing, with pollution control, with noise abatement, and also meat inspection and food inspection and hotels and all of these kind of issues. No longer is it acceptable for something as specialized as food inspection to be in the hands of somebody who is multitasking to that extent. Time has moved on, and they should be dedicated professionals with high degree of technical capacities, with a good level of education. And there is even a case for looking at the possibility, as we've done in other countries, of establishing a master's degree in food safety controls, which can then bring in professions such as public health or food science or veterinary science or medical science, microbiology, toxicology. All of those first degrees with an MSc in food safety is really a perfect state-of-the-art combination of professional skills. Then laboratories. Of course, laboratories are very important to have access to good testing capacities. If you're going to prosecute someone or deny entry of an imported food or seize food and destroy it, you have to have a solid legal and technical basis to do that. And laboratories provide you with that technical basis. So we use accreditation. All testing laboratories used by food safety authorities should be accredited to international standards. And there should also be access to reference laboratories nominated for every single test parameter. So laboratories are an important part of the system, but they are not the heart of the system, and indeed laboratories do not need to be based within the competent authority or within the inspection body which is performing the controls. As long as that body has a budget to be able to buy the tests from a competent authority, from a competent laboratory, this is sufficient. Then we have the role of science. Absolutely essential to inject science into the reform process, and indeed there should be available independent advice from a scientific panel to food safety risk managers. One person involved in developing regulations cannot keep abreast of all of the latest findings in food safety. And things are changing rapidly. New hazards are emerging and being studied, and in fact, new understanding of existing hazards is also moving quickly. So you need sources of scientific advice. And also there is a need to actively manage the linkages between food safety and the use of agrochemicals. It means that there has to be a way of ensuring food safety interests are represented in the registration of veterinary medicines and pesticides. So Food Safety Authority should sit on the relevant committees making those registration decisions. And you also need a crisis management system. Things can get out of hand very quickly with outbreaks, and unless there are tried and tested methods for sampling, testing, follow-up, inspections in a crisis, then things can maybe run out of hand even more. And we have seen that in many cases. There has to be a way when people are falling ill of identifying what is the source of the problem, finding that source and then cutting it off and ensuring that any foods which are already in the distribution system are recalled or withdrawn, so that the problem is, the effects of the problem are minimized to the greatest extent possible. And then we have governance to consider. So operational decisions about food safety must be isolated from ministerial intervention. Otherwise you get political or administrative convenience or political expediency start to interfere with decisions about food safety. As an inspector, we know that this happens, where you often cautioned against taking too strong a line with a food business where they have important political connections. Not acceptable, and the system should find ways of dealing with that. There has to be good consultation with consumers and agri-food businesses to make sure that measures which are proposed are practicable, they are feasible, and they can be achieved with reasonable cost. If a regulation is too expensive to be applied, it won't be applied. And then you have the choice. You either put people out of business or you don't enforce your regulations. Neither are acceptable outcomes. So regulations have to be commensurate with the level, technological and capacity levels of the food industry. And that you need to consult with the operators. And also, of course, you need budgets to be able to operate this system. Budgets both for investment in upgrading, but also for operations and for testing, because if you're going to operate laboratories, these are expensive items of equipment and infrastructure to be able to operate effectively. And if you cast your mind back to the cost and benefit analysis, absolute critical element of reform is investment finance for food business operators. Food businesses carry the majority of the costs of food safety reform in terms of investment in upgrading plant and equipment, training of staff, introduction of food safety management systems, higher levels of sampling and testing for their own checks, etc., as well as higher operational costs. So unless there is investment finance, nothing will happen. So the food safety policy should also answer the question, or at least address the question, of financial investment for food businesses. Absolutely essential, otherwise, again, nothing will happen. So these are some of the things which must be addressed in any food safety reform process. If you would like any more information, please don't hesitate to contact either our Chief Technical Advisor or myself on the addresses provided. Thank you very much indeed for your attention.